My name is Margaret Bell. I'm a nurse and midwife who has worked for Médecins Frontières. I think one of the most rewarding experiences was with the young woman in my first mission in South Sudan. She was a young woman in her 20s, we ascertained. She'd had 5 previous pregnancies, all ended in the death of her babies. And she came to see if she could come to our hospital to make sure her baby was born safe. We didn't have surgical facilities then. So the midwife at the time contacted the hospital in Kenya and asked could they take her and give her an elective caesarean section, because clearly there was a problem with her pelvis. I'll never forget both Sue and I standing at the airstrip, because you had to leave and come to this mission by plane, as did the people. When she arrived back and got off that plane with this baby in her arms, it was, and this face just beaming, it was just an amazing experience, an amazing thing to see this woman that was so happy now that she had this beautiful, healthy baby. It was very exciting. Of course you get emotionally involved. I mean, that woman, you know, everybody was crying that day when she got off the plane, you know, and even now when I think about it, it's sort of like, oh. So I think, and it's like even in Australia, you develop relationships with people, women, children, whoever you're caring for, and you do become involved with them. When you leave, it is a little bit distressing, and I think it's distressing because you know that their life is not going to change dramatically in the next couple of years because of the context they're living in, and you just cross your fingers and hope that they'll have a long, healthy life, but you don't know that. So I guess that's a little bit more, slightly different to the relationships you have here with your patients. One of the challenges we have in the field, and on all of my missions where I've done women's health, is that because women usually only come to you when there is a major complication that often ends in death of baby, mother, or both, there is often that stigma out there that don't go to the hospital because you will die. So part of the challenge is to change that thinking. So it's about changing, educating, I guess, the women as well as educating the Ministry of Health to try and improve services for women. I quite like where Médecins Sans Frontières, you know, is going in relation to that, because we have recognised that, and you know, we do have a component of women's health in all of our programs, regardless of what that might be. I think that's a very important thing.